Onc Live Insights is a video editorial program produced by Onc Live.
So there are various individuals that play a very important role when devising an antiemetic regimen. We start with the oncologist. He obviously will develop a chemotherapy regimen. That regimen may be a single agent or a combination of agents. That will determine the emetic potential of the regimen. At that point, generally it's discussed between nursing, pharmacy, and the oncologist what type of antiemetic regimen is needed. And again, we'll look at both chemotherapy-related factors as well as patient-related factors. The regimen is then written. We try to cover all those neurotransmitters in various pathways to make sure we prevent acute, delayed, as well as any anticipatory nausea and vomiting that may happen. The antiemetic is then given by the nurse. It's vitally important that the nurse gives it in a timely manner. Generally, that's 30 to 60 minutes prior to chemotherapy. It doesn't stop there, though. This is where a lot of the problems with current CINV regimens happen, that we really need to follow the patient and make sure that they don't have delayed nausea and vomiting, particularly when they leave the clinic or leave the infusion center and go back to their home. There are various regimens that have been used. Phone calls are generally made to the patient at home to make sure they're tolerating chemotherapy from a nausea and vomiting standpoint. This is also where education is very important, that the best reporter of any CINV is actually the patient themselves, and that's vitally important that they call immediately when they start to feel nauseous or if they have any emesis at home. Because we can't treat any breakthrough nausea and vomiting, but we can if we don't know about it. Then we also, when the patient comes back for the next cycle chemotherapy, again, we need to address CINV, knowing that if they had CINV with the last cycle, generally they're likely to have CINV again if we don't alter or change the regimen. So when we talk about the role of the pharmacist for prevention and treatment in CINV, we really do play an integral role in the process. It's very important that patients develop a rapport with their pharmacist when they do get their antiemetics filled, that they report to the pharmacist anytime they start a new medication other than the antiemetic, so that we can look for drug interactions and other potential problems with the combination of agents. It's also very important because pharmacists have a unique knowledge into the mechanisms of CINV and potentially can recommend to the oncologist different classes of agents to correct whether we talk about acute nausea and vomiting, delayed nausea and vomiting, or anticipatory nausea and vomiting. Pharmacists also look over the whole medication profile, again to make sure there's no drug interactions, but also to make sure that the appropriate combination of antiemetics are being used for the type of chemotherapy that's being administered. They also understand some of the patient risk factors. As an example, we know that women are more susceptible to the emetic potential chemotherapy than men. And just based on that knowledge, a pharmacist may be able to recommend to the oncologist a different antiemetic regimen just based on sheer sex of the patient. Finally, the pharmacist also has an overall picture of the medications that the patients are on from an antiemetic standpoint. So we know what the patient got in the past, and if they are still having problems, we know what they've used, and we also can look at what they haven't used, or potentially another combination. When we're devising an antiemetic regimen prior to administration of chemotherapy, we need to take in a lot of factors to devise the best regimen, especially when we're talking about whether to use oral therapy or intravenous therapy. We take in factors such as location of the patient. Do they have to drive a long distance to the infusion center or the hospital? Where if we can give them oral therapy that they can take it home prior to coming to the clinic, it may be more beneficial and prevent them from excess trips, particularly after chemotherapy. We also look at their insurance and what's on their formulary. We also look at other medications that they're on to reduce the issue of polypharmacy, particularly in those folks that are on a lot of other medications.